Welcome to Frontline News from the University of Maryland School of Medicine News Center. I'm Larry Roberts. Coming up, how COVID-19 can cause heart problems. But first, the COVID positivity rate is at an all-time high in many parts of the country. Highly transmissible variants such as the BA.5 variant are evading the immunity offered by the vaccines.
This variant started to emerge in our area just a couple of months ago, and it is now the predominant variant not only in Maryland but also in the U.S., accounting for about 54% of COVID-19 test positive cases in the USA.
Even if one of these variants break through, you are less likely to end up in the hospital if you've been vaccinated and boosted.
What we're seeing is that the vaccine still appears to protect against the severe outcomes of COVID, but not necessarily against transmission and milder forms of illness.
Pharmacists can now prescribe the antiviral Paxlovid to people who test positive and are at a high risk for developing severe COVID-19. Monoclonal antibody treatment is another option. In the long run, though, it will be important to develop a universal COVID vaccine.
It would be a vaccine that would cover any variant that would come along, no matter what the mutation, and the vaccine would still offer protection against that virus.
Until then, Dr. Lawrence says we should remain vigilant with mask wearing and social distancing as needed. School of Medicine researchers have been collaborating on an extensive heart data registry of BIG-10 college athletes who contracted COVID-19. Early in the pandemic, the BIG-10 required all athletes who had COVID-19 to get a comprehensive cardiac screening before returning to play.
The return to play protocol required that athletes undergo 5 different levels of screening to be sure that their hearts were okay. On the most basic level, the screening involved an exam by a cardiologist. We also performed EKGs, echocardiograms, blood tests looking for biomarkers of injury to the heart, and cardiac MRIs.
The cardiac MRIs revealed that 2.3% of the athletes had evidence of COVID-related myocarditis, a leading cause of sudden death in elite athletes.
Myocarditis is an inflammation of the heart. It can be, most commonly, it's due to a virus. It can also be seen in other settings, but there's some viral inflammation that's damaging the heart itself, leading to inflammation.
While some athletes had symptoms related to myocarditis, the vast majority had no symptoms and would likely have gone undiagnosed if not for the cardiac MRI.
Many of the cases which were positive for myocarditis, patients had clinical symptoms. But we even found cases where patients who had very little or even no clinical symptoms, but definite evidence of inflammation on MRI. And that was the biggest, revelation of the study itself, is that you can have evidence of inflammation even though the patient is not presenting with significant clinical symptoms.
Researchers say this finding likely means that a significant percentage of those in the general population who were infected with COVID-19 had myocarditis that was never diagnosed.
I would like for the general population of athletes, but for the general population in general, to know that it only makes sense to get the vaccine. The effects of COVID on a person's heart are demonstrably less, much less, if people get infected even after the vaccine.
The student athletes will be followed over time to determine whether mild myocarditis has any permanent impact on their heart health. The study was partially funded by the University of Maryland Strategic Partnership and involved collaborating doctors and scientists at the School of Medicine and College Park. And that's Frontline News. I'm Larry Roberts. Thanks for joining us. We'll see you again in 2 weeks.
For edema. Now, the myocardium should be homogeneous in signal. Here we see that there are areas of increased abnormality involving this infralateral aspect.